For teeth that are missing or damaged from disease, decay, or fractures, a dental implant is an excellent long-term solution to restore a smile. A dental implant is a cylindrical post, usually made of titanium, that serves as a substitute for a lost tooth root. Dental implants can replace individual teeth, several teeth, and even uncomfortable dentures. Implants are designed to naturally blend with your teeth, allowing you to confidently smile, chew, and speak, while also protecting the natural tooth structure of your remaining teeth. Healthy gums and a strong jawbone are critical in supporting your dental implant. If you do not have enough bone to support a dental implant, or if the implant will be too close to your sinuses, you may need a bone graft or sinus lift before placing the dental implants. These procedures help the implants become a reliable, healthy foundation for replacement teeth. First, the implants are surgically placed into the jawbone. Next, the jawbone grows around the implant and holds it in place. It may take several months for the dental implant to become completely integrated before the replacement teeth can be attached to the implant. This timeline is determined by the stability of each patient's implant, bone, and gums. An abutment is used to connect the crown to the implant. An abutment is a connector that is placed on or built into the top of the dental implant, linking the implant to the replacement tooth. Finally, the new replacement tooth is attached to the dental implant. For a single tooth implant, your dentist and dental lab will customize a new tooth for you, called a dental crown. This crown will be created to naturally blend with your smile based on size, shape, color, and fit. To replace more than one tooth, bridges or dentures are customized to fit each patient's individual mouth and implants. Your dentist may give you a temporary crown, bridge, or denture to help you speak and chew until your permanent replacement teeth are ready. To ensure successful dental implants, patients must maintain the health of their implants with regular dental cleanings and visits, paired with proper oral hygiene practices.